Hello, everyone. My name is Scott Bates, and I pastor Center Fork Baptist Church here in Hot Springs, Arkansas. Most of the time, you come to our channel for things like our Sunday morning worship services, our midweek updates, and occasional announcements. Today, however, we want to tackle an important subject for our community and also our church, and that topic is COVID-19 testing. And now that kids are back in school and colleges have come back to are back in session, I think testing is on the minds of a lot of people. So I've asked someone from the Healthstar Physicians lab to join us. Her name is Natalie Henderson, and she's going to be answering some questions about COVID-19 testing. And our goal is to just get good information into your hands and into your homes so that you can make good, wise decisions concerning your health. And so if you think this video is helpful, share it on Facebook, share it on other social media platforms, email it to as many people as you see fit so that other people can benefit from it. So we hope this helps. Hello, Natalie.
Hi.
Thanks for being willing to serve our community and just be interviewed today. And our goal is simple. We're just trying to shepherd people through this very difficult, kind of confusing time by offering them some truth about testing for COVID-19. So that's why we're doing this interview. So why don't you begin by explaining to folks what you do at Healthstar Physicians and how you serve our community.
Sure. I'm the laboratory director for Healthstar Physicians. I'm over 10 laboratories here in Central Arkansas. Each laboratory is CLIA certified. We run CBCs, urinalysis, your basic strep-in flu kits, and then we have one large central laboratory where everybody sends all their blood at the end of the day, and we run their chemistries for them.
Okay. Well, tell us a little bit about your background. What's your title? What do you your education?
Sure. I have a Bachelor's of Science degree in biology with a minor in chemistry, and I also am a medical technologist, and all of the schooling required 6 years, and it's a bachelor's degree.
Okay. So in your job for Healthstar Physicians and working with all these laboratories, your lab monitors, I guess, constantly the Arkansas Department of Health guidelines.
Yes.
And then you guys try to do exactly what they're trying to tell you.
Yes, we follow all of the Arkansas Department of Health guidelines. We fax in all the COVID results at the end of the day. We are audited by the Arkansas Department of Health, which is also CLIA, and have to keep up with everything.
Has that been difficult for you guys? I know the guidelines have sometimes been a moving target on the federal and state level.
Yes, it is, and so we have to stay current with all of the guidelines from the CDC all the way down to the health department and then the Garland County Health Department, and it takes us a while to kind of figure out what's going on.
Right. Well, why don't you explain? Many people in our community may not know how Healthstar has been involved in the COVID-19 testing in our community since the beginning. So why don't you just give us a little background on that?
Sure. Since March, Healthstar has been on top of their game from the beginning. They wanted to make sure that our patients and our community was safe. They started by getting the HVAC systems in all of the clinics where it would put out ultraviolet lights and kill any viruses that could be lingering around. They also went beyond measure trying to find us personal protective equipment, which we call PPE, because there was a worldwide shortage. Then they set up 3 locations here in Hot Springs with the tent. So we could have patients come in the tent and keep our well patients safe and keep our sick patients away. We did that at our First Care Walk-In Clinic, at our Lakeside Clinic, and our Fountain Lake Clinic. And then we also had 2 other outlying clinics, one in Glenwood and one in Mena, that also did the same thing.
How did the community respond to you guys? As I know you had shared with me how the community responded, especially initially about the PPE and the need for some of that.
Sure, we had lots of patients just drive by and donate any kind of mask that they could find at, paint stores, whatnot, Lysol, wipes. It was an amazing outreach from the community.
Right. That's some of the good news. Good job, community. Thank you for that. And that's some of the good news we need to spread. So let's begin with the simple but important question. When should I get COVID-19 testing done?
Sure. So if you're within the general public, anytime you have cough, fever, respiratory symptoms, you always want to call your primary care doctor and ask and see what they recommend. And then at that time, if you've had direct exposure, you would want to go get tested. If you have been around anyone who thinks they have been positive, if you've been asked by your employer or asked by the local health department or state health department to get tested, you would obviously want to get tested under those circumstances. There's a little bit different scenario for the school faculty and teachers and students. They're a little more strict. If you have normal symptoms of like asthma, cough, congestion, and you have a history of allergies and asthma, you want to follow up with your pediatrician or your local primary care doctor and just see what they think. If you don't have a history of asthma or allergies and you're having cold symptoms, I would still go see your primary care doctor and let them decide whether or not you need a COVID test at that point.
Okay. So exposure, right now, the guidelines for exposure are within 6 feet for 15 minutes or longer?
Yes.
Okay. And so that's kind of the protocol that everyone's using to determine what exposure is.
With a confirmed positive.
With a confirmed positive.
Right.
Okay. So somebody that we know is confirmed, a confirmed case. If you're with that person for 15 minutes or longer within 6 feet, then you need to contact your primary care physician.
Yes.
And I guess there's also some information, we can put this up on the screen, a flow chart for students and staff at schools.
Yes, the health department has sent out this flow chart. It's a little hard to follow, but if you follow the lines and the arrows, it's got some great information on it.
Okay, well, if my primary care doctor or I determine using these guidelines myself that I should get tested, where should someone get tested locally here in Garland County?
Sure. Our First Care Walk-In Clinic has rapid testing available for symptomatic patients only. However, we are running short, and it would be best to call before you come, just because we never know when we're going to run out.
Right.
I'm pretty sure that the Garland County Health Department and all the local health departments are on track to get rapid testing themselves. Okay. So if we happen to be out, you could call the Garland County Health Department as well to see if they have any available.
Okay. If you get tested, let's say you don't get tested at a Healthstar facility, we know you guys are certified and a reputable testing facility and physicians group. If you get tested elsewhere, how do you know if where you're being tested is a reputable lab and something that the Department of Health would give their seal of approval to? Absolutely.
So most of the larger health care providers here in Central Arkansas are definitely reputable. Like your CHI, National Park, Baptist, all of those you can trust. It's the little off-brand places that pop up around that are just trying to make cash. Anyone that does not take insurance, I would be leery about going to see them. And when you go, you need to ask specific questions. Ask, what kind of test is this? Is this an antigen test, a PCR test, an antibody test? Is it a swab? Is it blood? Are you CLIA certified? Because CLIA is the Department of Health. They audit those labs. And if they're not, and if they don't take insurance, they only take cash, I honestly wouldn't trust them.
Okay. So to kind of summarize what you just said, if you roll up to a testing lab and they only take cash and not insurance, that's a red flag.
Yes.
You need to ask them, are you CLIA certified? And CLIA is the part of the Department of Health here in the state of Arkansas that certifies labs, audits labs.
Yes.
And then, ask them what kind of test. Is it an antibody test, which we'll get into that?
Yes.
Is it an antigen test? Is it a PCR test?
Yes.
Okay, so ask those kinds of questions. Well, let's talk about testing. One of the confusing aspects of this pandemic has been testing, and because it's a brand new virus, it's called a novel coronavirus because it's brand new, which means we've had to develop on the fly all sorts of tests to try to get to try to identify the virus. So, if you could just give us a brief overview of the 3 different types of tests that are out there and what they do.
Sure. So the first test that was created for the coronavirus was the PCR test, and PCR stands for polymerase chain reaction. It's looking deep into the DNA. It's actually the RNA that they're amplifying, and it is the most sensitive and most specific test out there. It's also the most expensive. So that's why they've created the antigen test. The antigen test is more of a screen. It's cheaper. It's looking on the surface of the protein, and it doesn't go into the RNA. So that being said, while it's cheaper, if you're negative, you might not really be negative. You really need a backup confirmation test. So if you go in and get the antigen test and you're negative, you really want to ask for a confirmation PCR test. And then there's the antibody test. The antibody test was created later in the scheme of things. It's very useful information, but it is not supposed to be used as the sole basis of diagnosis. And any epidemiologist at the health department will tell you that. I've had several conversations with them to let us know that we should not be using that for diagnostic purposes. Although it is interesting to see if you have these antibodies developed in your body, the main antibodies they're looking for is IgG and IgM. And your IgM will spike between 5 to 7 days of exposure, and your IgG will spike much later than that. So a lot of things that I've been seeing in the community is a patient coming to get a PCR swab, a rapid swab, or an antigen swab, and it's positive. And then they'll come back a day later and go get an antibody test ran at a little place that's just doing rapid antibodies, and that will be negative. And they're getting mixed feelings about that. They're like, okay, well, you said I was positive and you said I was negative. Well, not every test is created equal. Right. That's why you have to ask questions. Which test did you have to begin with? Well, you have PCR. That's the most sensitive, the most accurate test out there. And then on the other hand, you had an antibody test. Well, if you are positive today, you may not be positive yet because you haven't developed those antibodies yet. Your body has to develop them, and there's a delayed antibody response. So just because you're positive on the PCR does not mean you're going to be positive the same day on your antibody test. We actually recommend at Healthstar, we run an antibody test. We recommend waiting 14 days post-exposure to have that test performed. Okay.
So let's just back up and just talk about each of those a little bit, and I just want to kind of recap. The antibody test is a blood serology test. So if you ask them, is it what kind of, they may use a big word and say serology. That just means it's a blood test.
Yes.
And when that happens, you know that you're really not looking for active. You can't use that test to find active virus. That test should be over here, separated from antigen and PCR.
Correct.
Okay. And so if you've seen the picture of the novel coronavirus online and you see this logo everywhere, a little spiky ball, the antigen test is looking at the outside shell of that virus, or bits and pieces of that protein. Whereas the PCR is going inside of that shell looking for the genetic material.
That is correct.
The RNA. And there's also a difference in the testing as far as capacity, how many tests you can do with antigen versus PCR. Could you talk a little bit about that?
Sure. So the PCR test that they have at the big reference labs like Quest, LabCorp, AEL, they are huge, monstrous machines. Okay, they're called high throughput instruments. They can run thousands and thousands of samples at once, and it takes about 4 or 5 hours for that complete PCR amplification of RNA to take place. Versus we have little rapid PCR machines in our office. They can only do one at a time, so it's not near as convenient. And then the antigen test is also on a small machine, and it can only run one at a time as well.
Okay. So you can see the differences. So whenever we run out of antigen tests on the local level or PCR rapid tests, those are point of care, one at a time,
Yes.
whereas the ones we're sending off to the big laboratories, they can run hundreds of those at a time.
Yes.
And that's why we depend on those commercial
That's
labs.
right. That's right.
To get through all of those, that amount of testing. So how is the HHS on the federal level and the Department of Health involved in determining who gets what in rapid testing?
Sure. Well, it took Arkansas a long time to get the rapid testing. They started out in hotspots. They would send all of the reagent to New York and California and Florida, all the major coronavirus areas. And then later, towards June and July, we were able to get our hands on some, and they actually sent us 2 rapid PCR instruments, the health department did, and they are sending us a very limited supply of the rapid PCR reagent kits. So the government is still in control of all coronavirus reagents. They decide which state gets how many, and then at a state level, I know that Arkansas was getting 50 rapid Abbott ID Now kits every week, and then from the state level, they decided which clinics, which healthcare facilities would get how many. And at first, there weren't very many running them, but now there's several places in Arkansas that are running them. And so now Healthstar is only getting about 3 kits every 2 weeks. And that's not a lot. There's only 24 in one kit. So
it really restricts how, and that's why you have to restrict the rapid tests to those who are symptomatic.
yes, sir.
So that we can, and what about antigen tests? Are antigen tests available to most clinics like yours yet? Is that something that's even available widespread?
No, it's not. It's been FDA approved for an emergency use authorization, but as far as I know, I know Central Arkansas has not received any of the rapid antigen testing just yet. I have placed an order for several, and I've been approved for that order, but they have not released the order to be shipped to me yet.
Right. Well, we understand that there's been supply chain issues ever since March, not just in the healthcare world, but all the other supply chain issues because of this. Okay. One other follow up about the 3 different types of tests. We did mention the antibodies, and you did a great job explaining that. Are people at risk for a second infection? If they've had the infection, are they at risk for a second infection? And kind of what's the best information that we know about that at this point?
There is a lot of unknown with that statement right there, but from what I have read, I've seen 1 positive reinfected patient here in the United States so far that's been reported. All the research that everyone is doing, it's going to take more time because this is such a new thing. The longer we have with this coronavirus, the longer we'll have to make new research development. But the best information that I have found right now is that most antibodies are staying in the system for roughly 3 months. Okay. That being said, I would believe that we would be susceptible to getting this again, especially without a vaccine available.
Okay. And is your lab doing any testing or any trials or anything like that with people that have been infected? Are you?
Yes, I actually started a research project of my own because we are able to run the antibody. It's a total antibody test, a combined IgG, IgM on our patients if they're willing to volunteer. We are just going to draw blood on a confirmed positive PCR patient once a month and just check their titers to see if they stay level, if they trend down, and how long they stay active in their body.
Basically just tracking the level of antibodies in their blood and then how it dissipates over time. That is correct. And do that with enough people, you might get an idea of how long the antibodies actually are there and active.
Yes.
Okay. So there have been some problems with testing, obviously. It's a novel coronavirus, so we had brand new machines, brand new tests, brand new protocols for labs, for techs, a lot of new things over the last few months. So could you kind of walk us through what some of the problems were early on, and still some of the problems are with testing?
Sure. The main issue, it's supply and demand. This is a new test, and it took a while for them to invent the test, to create it. You don't just want to throw something out the door and it not even be accurate. So that was the big issue to begin with. There was not enough reagent for all of these big commercial labs to go around. And then we've heard lots of stories of false positives and false results, and a lot of that comes from the actual methodology of PCR. It's very sensitive. What you're doing is you're amplifying that RNA to a whole strand versus, the minute amount that you originally collected. And when you do that and you've got 200 or 300 specimens on an instrument, if there is a bubble, if there is a spill, a splash, anything, then all of that amplified DNA is now everywhere. And then if that particular sample had been positive, now everybody's sample is positive.
Right.
And so it's new technology. There wasn't enough time for proper training, proper protocols. They threw it out the door, and anytime that you're in this kind of situation, you're going to have problems and chaos.
Right. And many of those problems have been rectified.
Absolutely. Yeah, they have learned a lot from first mistakes, and I think they've got a very good handle on all of their testing now.
So now we hear Governor Hutchinson and in his daily report mention commercial labs. And that seems to be a bottleneck for testing. Could you explain why that is?
Sure. And again, it goes back to the supply and demand. These companies, they have invented this test, and there's only a small amount of reagent, and they're trying to build new factories. They're trying to slow down the production of flu and strep so they can focus on coronavirus. And in the meantime, there may be a situation where we run out of flu and strep tests because they're so busy trying to create the coronavirus test. And you just get in a situation where, and it's not just reagent, it's the swabs, and there's a transport media that the swab has to go in for these commercial labs, and they've run out of those too. So they're having to make their own media and swabs. We've had 3D printed swabs, which are not comfortable. They are not soft. They are hard. So it's just been a whirlwind with this whole situation.
Right. And in addition to all of that, then we have a limited number of commercial labs that can actually run these high throughput tests.
Yes, and actually, I've seen a lot of new commercial labs pop up out of nowhere, trying to see. They're seeing the demand for this, and it's good business. So we've seen lots of smaller reference labs per se come up. But yeah, your main Quest, LabCorp, AEL. We personally use AEL just because they're not as big as Quest and LabCorp, so in the get-go, they were amazing. We were having 2 and 3 day turnaround time versus your big, huge labs, Quest and LabCorp. They couldn't handle the volume because they had too many clients.
Right.
And so bigger is not always better in this situation.
Okay. Well, a couple of last questions, and this is, I think, an important thing to think through. Social media can be a bad place to get information about anything. It can be a good place to get news occasionally, but everyone, it seems, since March has become an armchair epidemiologist. I even learned how to say that word, virologist, infectious disease expert. I read this report now. I tell people all the time when it comes to spiritual matters that you really can't do church online. Church has to be together to really function as God intends it. You need a church family of people. You need people who know you know them, a pastor, those kinds of things. You need pastors in 3D. And I think that illustration, you need real people you trust to help you find truth, whether it's about spiritual matters or about medical matters. So with that said, if you have questions about COVID-19, if you have questions about what's going on and the CDC changing guidelines, who's the best source for information for someone living here in the Lake Hamilton community?
Sure. So Healthstar is extremely knowledgeable about every coronavirus aspect right now. If you don't have a Healthstar as your primary care doctor, I would call your primary care physician and just see if they are knowledgeable. If not, I'm going to share with you an email address that you can put up here in a few minutes.
Okay.
It's an info email address for Healthstar, and you can email it and ask any question you want, and we will get back with you as soon as possible with a good response. Our CEO Rachel Wallace is on top of this entire coronavirus situation. We are getting all of our information from the CDC and from the Arkansas Department of Health.
So basically, the best source to get good information about your health is your primary care physician. If you don't have one, get one.
Yes.
Because these are people that know you, that know your history, and can help you get good information. And then, of course, if you don't have one, there's the info line with Healthstar Physicians.
Yes.
And that would be a great resource as well. And then if both of those aren't avenues you want to go down, you can also call the Garland County Department of Health.
Yes, the Garland County Department of Health is a great resource for this community.
Well, one last question, and this has to do with what you do for a living, okay? You're a scientist.
Yes.
Okay, you have a degree in chemistry and biology. And so one of the problems that I've noticed is that people get frustrated when scientists change their mind about something.
Yes.
So explain to me why scientists change. I know the answer to this question, but I'm going to let you answer it. Why do scientists sometimes change their minds?
Well, so especially when something is new and they've just discovered it, which this is all new, the data and the research changes daily, sometimes by the hour. And I know a lot of people are getting frustrated with the CDC or the Department of Health or the governor coming out with something new or changing this information on a week-to-week basis. And they're saying, well, you must not have known what was going on to begin with. Well, you're right. We didn't, because this is all new. And we can only go by what the research and data tells us. And if that research and data changes over time, then we have to change what we say to the community over time. It doesn't mean we were giving false information.
Right.
It just means that we're learning something new daily.
Yeah, it's and I'll give another spiritual illustration. I've preached a lot of sermons and over the course of my time, and I've discovered some of the things I used to say were just flat wrong.
Yeah.
And so I would be a fool not to change my opinion about something based upon new and better information that I've discovered through study, through research, and through talking to other people. It works the same with scientists. You guys are working with data, you're working with tests, and the big issue is time.
That's right.
And when you put data, testing, time, and working through all that, you're going to get good results, but it takes time. And we live in a microwave, impatient culture.
Yes, we all need instant gratification, and it's just not the case with science data.
Right. And so I guess what I would say to our community is, hey, give your primary care physician, your nurses, your doctors, and those in trying to lead this charge, give them some grace, because they're doing the best they can and doing a great job. And so on behalf of the community, I want to say thank you for serving us so well and doing the best you can to keep us safe and healthy.
Thank you.
Thank you for coming today.
Sure.